Hi, this is Anchor Shivani Gupta. I am here at Anicon 2022 in the city of Joy, Kolkata, and here with me I have.
I'm Dr. Shubhankar Mukherjee, currently a practicing neurologist in the area of Asansol. I mainly practice in Asansol and Jamuria belt.
Sir, we at IPCA, we are creating awareness about winning over epilepsy. So, sir, I would like to know from you what are the major treatment gaps in India and how rooted this problem is.
There is many stigmas prevailing in the currently in the rural India. Since my practice is based on the rural India based practice, so there is many stigmas that are prevailing, and that's why the patient that comes to us, they delay. There is a delay in the diagnosis of the epilepsy, and there is a delay in the starting of treatment. So it causes a severe lag in the treatment gap, and this causes mental problems in the patients, and also the drug. Many of the drugs they cannot afford and they cannot continue, and they do not have any idea that I have to continue the drugs. They think that I'm epilepsy free now, so they usually stop the disease, the treatment, and the disease recurs, and this is the main problem we face in our practice.
Right, sir. And I would really like to know from you what is the most common myth which you have come across till now?
Yeah, they might see that this is a curse of some god, or there's some demons that they get affected with some demons, and this is the common myths that we get in the rural India. Yeah.
Yes, sir. If you have to burst any myths, so sir, what you want to say to all the people, how to find that epilepsy is hitting them at a very early stage?
Yeah, that's the thing that we have to set some example to the patient. That see him or see her that you are thinking that it was demonized, but with this treatment, she is absolutely epilepsy free now. So some examples are to be set, and that to be give awareness among the patient through those examples. So we can create a mass education program, mass awareness programs, and some shows like the shows that are really acceptable to them. Those shows can usually help to elevate this problem.
Right, sir. What is the most common type of epilepsy which you treat amongst the patients?
Most common type of epilepsy are the focal epilepsies, and some GTCS are also prevail, but focals are very much common nowadays.
And sir, it is curable?
It's curable with adherence to treatment, with proper treatment and proper guidelines. It is curable.
And what is your take on if somebody says that a person who is having epilepsy cannot lead a normal life? Do you agree with that?
Absolutely, I disagree from this. A person with epilepsy can lead a normal life like you, like I. Absolutely, a normal life can be led with use of medications. And they can lead a normal life. Yeah.
That's really nice. And sir, one last message for all the people who are suffering from epilepsy at the moment, or they have just started getting those symptoms of epilepsy. What do you want to give a message to them? What message you want to give them?
Yeah. The message is that kindly stick to the advice of the doctor, follow the medications properly, and do not fear, and do not think that you are behind the normal ones. Always feel you are normal, and there is nothing as such that can stop you from achieving your goal. That is the main message I want to give them. Just stick to the treatment and the treatment goal that is set, then it will be okay.
Right, sir. Thank you so much for joining up covering over epilepsy, and I hope this is going to help a lot of patients, and this is going to create a lot of awareness after this. Thank you so much, sir. It was lovely having you here.